My name's Forrest Arthur, and I'm one of the Addiction Medicine Fellows at this facility. Well, initially I decided to go into medicine at a time in my life in high school. I was trying to decide what I wanted to do, and one of the things I knew is that I always had an interest in the sciences. I was very science-oriented, less artistically oriented. At that point in time, I had an interesting little sidebar in my life. I used to show horses, and I had a very good friend in my horse experience who was a physician, an older man. And as I got to know him, he discussed his specialty with me quite a bit, which it was surgery. And I developed an interest in it. And when I thought about how that would dovetail with what my skills were, my perceived skill set, things I liked, things I didn't like, it seemed like an excellent choice for me. So that's why I initially went. Well, after I did my training in surgery, which was a 5-year residency program, I went out and practiced. And I had several years of a very successful surgical practice in St. Petersburg. I practiced general vascular and trauma surgery for many years. At some point during that process, addiction touched my life personally. And at that point, I took time from medicine to deal with my own personal issues. And during that period of time, I had the opportunity to take an administrative position at another local treatment facility. And it was an interesting treatment facility because it was one of a very small number at that time that specialized in treating healthcare professionals. And so obviously I had a personal interest in that, and I worked administratively at that facility for several years, in fact about 8 years. At that point, this fellowship was developed at River Oaks and through Brandon Regional Hospital, and I had the opportunity to participate in it. And I had a great interest in doing that and returning to medicine in this field, so I took that position. Since the people in this training program have already not only finished medical school, but done a residency, perhaps even practiced in medicine for a while, all of us are really fairly adept at just the basics of being a doctor and taking care of patients. So certainly that's an important part, our clinical training in this program, because there are differences in this field from areas in which we worked previously. But one of the very important things is learning all of the basic science that comes with addiction medicine. There's a lot of neurochemistry, learning how drugs affect neurotransmitters, learning what drugs can be used to treat different types of addictions. You're learning what medications are more or less appropriate for different co-occurring mental illnesses. So there's a lot of basic science involved in doing this. As part of the training program, we have these didactic sessions where on video, a presenter actually goes through and discusses all of the chapters that are involved in the major textbook that we use, which is called the Principles of Addiction Medicine. So it's really just an adjunct to the textbook reading, something where there's a presentation and little quizzes that are given to help further our knowledge in some of the basic science. It's rewarding to me because I've lived this and I understand the misery that can come with being in active addiction and the confusion that you can feel, that any person can feel going through this and trying to figure out why they're behaving the way that they are. And so to be able to use my experience and my training here at this facility to help people see and gain insight into what they're doing is something that I'm just very passionate about.